So I'm Stuart Nunnally, and I've literally been in practice now for 33 years, and practicing in Marble Falls, Texas for all of that time.
And I'm Lane Freeman, and I have been practicing in Marble Falls for 11 years. I was able to join Dr. Nunnally after finishing dental school and getting to experience a whole new way of practicing dentistry, providing care that not only addresses what's going on in the mouth, but also how it affects the overall health.
Well, the thing I think that separates us from most dentists is that we're so conscious of what we put in a patient's mouth and its impact on their systemic health. So we're very, very much aware of the need to use biocompatible materials. We test most of our patients with using a biocompatibility test to see what materials would be compatible with their systemic health, with their serum, with their blood. And so that probably is the thing that distinguishes us most. The other thing might be that we want to serve our patients in a way in which they've never been served before. We want to take care of them like we would our own family. And so we hope that, in fact, that most patients would leave there saying they've never been tended to in quite the way that we do that.
Dental work typically produces quite a bit of anxiety for a lot of people, and so our goal is to remove that anxiety and bring about a comfort not only with what they're having done by informing them of all their choices and the pros and cons of different types of materials and treatments, but also in making sure that every comfort is attended to so that they are able to just relax and focus on healing. What also I believe sets us apart is the privilege that we have of having so many physicians refer their patients to us in order to partner with them on achieving health for that patient. So that's a very neat way to integrate dentistry with the medical community.
I think that there's no question that both of us feel completely called to dentistry. That, in other words, we feel like the Lord has called us to do this, that our business, that our practice is a ministry. And it's just a wonderful thing to be able to go to work and not only have that be your work, but your joy and the area where you feel like you're really serving in the way you're called to do.
And it is really fun to hear from patients the difference that we make in their lives by the way that we practice. Just not only the care that they receive, but also just the commitment that we have to making sure that our dentistry is supporting their health in all the ways that we can.
Our mission statement includes the sentence that we would exceed our patients' expectations every time. And so that's our goal. We want to provide a service that's not just the best service in dentistry. We want to provide the best service a person's ever had, whether it's in a wonderful spa or hotel or whatever. We want to exceed the Ritz-Carlton experience. We want it to be an absolutely marvelous experience where that patient leaves and knows every issue has been tended to. There's so many components, I think, to healing. And oftentimes teeth and the things going on in our oral cavity are having a true impact on our systemic health. But there's even more to it than that. Many times patients come to us saying that we're their last hope. And they've seen many physicians, and finally maybe one has said, you know, maybe it's in your mouth. And so they come to us and they say things to us like, you're my last hope. And I always say, no, we're not your last hope. We're going to do our very best. We're going to take care of you, I hope, in a way that you've never been taken care of before. But one of the things that they'll find when they come to our practice is we're going to listen to their story, because we've been through that same story. We know ourselves what it is to have a bout with a toxicity issue. And so I think it's actually an honor to sit down with a patient and hear what they've been through. And I think that actually begins the healing process, because so oftentimes patients have never had anyone do that with them.
That's correct. A lot of patients will say that every symptom that they've given to multiple doctors has been just discounted as it being all in their head. And when they finally have someone that will listen to them and gives them, puts some credit to what they're saying, and even if we're not able to say we can fix that, we can listen, and that does really have a huge impact on their psychological and spiritual well-being, to know that there's somebody there that cares and that's listening. And so we take that very seriously. All of our staff know that we want to listen to our patients, and they've all got an individual story. That is another thing that does set us apart, is that each of our patients, we want them to feel like it's not just the same old treatment that is given to everybody. Each patient is an individual. Their body is going to respond differently to things. Their teeth are going to respond differently to things, and their personalities are all different. And so each patient needs to feel like they're not just being run through the same mill. They're looked at as individual, and they're treated as individuals. So that's another thing that sets us apart.
I think there's nothing that we really enjoy more than partnering with a patient, especially if we're partnering with a patient and maybe one other caregiver, where we really form a team and we work out issues, and we can give the patient such tremendous support in that way.